Thumbs up. Okay, so do gather around, it's fine, and Jane will just work around with the camera in between you. So the main indicator muscle in Touch for Health that we learn for gallbladder is the anterior deltoid. Okay, so anterior deltoid is right here. So, and because we use this anterior deltoid for so many other different, like just general indicator muscle functions, I always just generally say anterior for gallbladder and hold. That's locking nice and solid. And then this one for gallbladder, push upwards, hold, and that locks solidly as well. Now, in the applied kinesiology text by Walther, they put the anterior deltoid, they reflex the anterior deltoid to lung. So which one is it? In Touch for Health, it's gallbladder. In the applied kinesiology system, it's reflex to the lung. So certainly, while we're working in the Touch for Health system, we generally relate it to the gallbladder, and a lot of the tests we do for gallbladder are anterior deltoid, but of course the next muscle is the popliteus. And that's definitely, even in the AK book, as well as the Touch for Health system, the popliteus muscle is definitely reflexed to the gallbladder. So if you want to see the popliteus muscle, it's this muscle at the back of the knee. You can zoom in on there. It's like a little square, like a rhomboideus type muscle. There it is, there's got a medial attachment on the tibia, and it comes right across the knee joint and attaches to the lateral part of the femur, the distal femur, right on there. And what it does is it actually rotates the lower leg internally, like medially. So while the leg is straight, the leg can't, there's not much rotation available there, but when we have the leg bent, and what can happen is, are you okay if you're on the thing? Yeah, cool. So while we have the leg bent, then there can be this rotation. So Daniel, can you just rotate inwards this way and then outwards? And come inwards and outwards. Now hamstrings are driving a lot of that, but also popliteus is driving the one inwards, okay? This is a really important muscle for what I've been discovering of late with my clinical work, is when you have someone lying down this way and you, I don't know if this is going to draw up because these are pretty tight jeans. If you pull this one up, and there it is. So you know where the patella is. Normally you have the patella right there, and there's what the quadriceps and quadriceps insert around the patella. It's the sesamoid bone, and attach into the bone here called the tibial tuberosity. The tibial tuberosity. Okay, it's a little projection there. But often you see, I find this in women a lot. The lower leg is rotated outwards. It's rotated laterally, okay? And I don't know if that's to do with anything to do with gallbladder, but what I have noticed is when I test popliteus, and a lot of women who have that lateral rotation of the lower leg, where the tibial tuberosity is way out here, by switching on the popliteus, it actually comes back in. It comes back immediately. Very, very, so from that point of view alone, I think this test is absolutely essential. Of course, in a lot of other kinesiology systems like TBM and also NOT, neuroorganization technique, the gallbladder meridian is related to connective tissues. I don't know if that's true in acupuncture. It's related to connective tissues, so it has that association. But the test for it, we bend the knee, okay, and we're going to just come up, we're going to dorsiflex the foot, and then I'll get you to rotate the whole lower leg inwards, that's right, and then I'm going to cut the heel, take the hand on the inside, and I'm going to turn outwards, okay? So I want you to hold the leg, the foot and leg in that position, okay? Hold, and that's unlocking. So the correction, where's the neurolymphatic for the popliteus? Is going to be on the, it's set at the liver, so you put your hand over there, that's perfect, good. And then rotate it in, and then hold, and that holds really, really strong. Neurovasculars also, strange neurovasculars in this one, because you've got neurovascular on the throat, and also at the back of the knee as well, about 3 of them at the back of the knee, it's curious. So this is a really important test from the point of view, if someone's getting some leg length, if you're doing leg length measuring, sometimes the leg lengths won't match up to what you're measuring with the pelvis, because this lower leg is rotated laterally. Switch the popliteus on, test the popliteus, if it's unlocking, switch it on, and within a very short period of time, ask the person to do this exercise a lot, just keep turning it in, and have a sense of holding that there, so they're kind of retraining the neuromuscular system, and it will actually, the bone, the position of the bone in neutral will then shift back to a more neutral position. That's the kind of the main point I wanted to say, because I've been noticing that recently in my clinical work, trying to figure out how to get this thing around, and I found you can use orthobotomy techniques like orthobotomy isometrics, but I found switching on the popliteus very, very effective and very, very quick. Okay.